Welcome everyone to the Living Well with a Blood Cancer virtual conference. The Leukemia and Lymphoma Society of Canada is proud to introduce this presentation, Beyond Tired, Understanding and Managing Cancer-Related Fatigue Through Physical Activity. In this 75-minute live webcast, Ellen Conte will explore the causes, impact, and evidence-based strategies for managing cancer-related fatigue. And Nicole Culos-Reed will share how physical activity tailored to individual needs can play a vital role in improving energy levels, emotional well-being, and overall quality of life. Before we begin, let me introduce myself. My name is Isabella Garofalo, and I am a Community Services Lead here at the Leukemia and Lymphoma Society of Canada. I will be the moderator of this online event. We invite you to type your questions and comments in the Q&A box of the Zoom webinar panel throughout the presentation. An LLSC staff member will monitor the questions, and I'll read some of your questions aloud at the end of the presentation. I would like to remind everyone that due to the large number of participants and limited time, we may not be able to answer all the questions. And please note that Ellen Conte and Nicole Culos-Reed cannot answer specific questions about a person's health history or status. Today's presentation will be recorded, therefore you can rewatch it again on our website. And then before we get started, I just want to take a second to do a land acknowledgement. Next slide, please. As we come together from across Canada, we recognize that we are on lands cared for by many Indigenous nations. We honor the First Nations, Inuit, and Métis peoples whose deep connections to these lands enrich our community. We value Indigenous voices and are working to ensure they are truly represented in our leadership and staff. At the Leukemia and Lymphoma Society of Canada, our commitment to diversity, inclusion, belonging, and health equity guides how we work to support and uplift everyone affected by blood cancer. Next slide, please. Before we present the first speaker, I want to share the important mission of our organizations. Are you looking for specific programs or resources, but not sure where to find them? We are here to help. You can connect with the Community Services Lead in your region to receive personalized assistance and get connected to resources in your area. Please reach out by calling toll-free at 1-833-222-4884. Thank you. We know that having a diagnosis of blood cancer can be very overwhelming, but know that you are not alone. There is a blood cancer community that is here to support you every step of the way. As mentioned earlier, you can access one-on-one support to help you navigate the blood cancer experience. We invite you to visit our website where you will find tailored information and resources in multimedia formats to address the variety of needs and preferences. The information and resources on our website, bloodcancers.ca, are tailored and presented in multimedia formats to address the variety of needs and preferences of our community. This includes fact sheets and booklets like the one you see on your screen, along with podcasts from our channel called The Blood Cancer Experience. Check out our resources to learn more about cancer-related fatigue and brain fog and being active during treatment. Visit bloodcancers.ca to read, listen, and watch all of these great resources. Eating well is vital but not easy during cancer. We can help. Good nutrition can help people with cancer stay stronger and better tolerate the side effects of treatment. But cancer and treatments can affect your appetite, weight, and even the taste of food. Your regional community services leads at the LLSC will help you book a 30-minute phone consultation with a registered dietitian with expertise in oncology. There's no charge to you, and advice is tailored to meet you where you're currently at in your blood cancer experience. Okay, now, today, we will hear from two panelists, Ellen Conte and Nicole Culos-Reed. I'd like to introduce our first panelist, Ellen Conte. Ellen Conte is a naturopathic doctor and clinical researcher who completed her bachelor's in biochemistry and psychology and her doctor of naturopathic medicine degree at the Canadian College of Naturopathic Medicine and a residency in naturopathic oncology at Ottawa Integrative Cancer Centre. She is a fellow of the American Board of Naturopathic Oncology and is a member of many boards and professional groups to count. Ellen provides comprehensive support for cancer prevention, complementary care during cancer treatment, survivorship, and palliative care. Over to you.
Hi, everyone. I'm just going to start my video here. There we go. Make sure I can control the slides. There we go. Okay. Let's get going. So thank you for having me and Isabella for the introduction. We have a lot to cover today, so I think we're going to kind of jump right in. And I'll skip over the about me. I think we heard enough about me from Isabella there. As Isabella mentioned, I am a naturopathic doctor. I have a private practice where I work mostly with people who have had cancer diagnosis and provide supportive care before, during, and after treatments. I also work in research, and my research focuses on integrative and complementary strategies for helping people with cancer. So today we're going to talk all about cancer-related fatigue. I'm going to be talking about what it is, the impact it has on individuals, causes, and then we'll talk about some management strategies. And then Dr. Culos-Reed will take over and talk more about the exercise piece. I do want to acknowledge a language piece here, which is that I will frequently use the term cancer survivor. And there's two things that I want to say about this. The first is that when I use that term today, I am meaning anyone who's been diagnosed with cancer, in this case, blood cancer, whether you were diagnosed yesterday or 10 years ago, whether you're on active treatment or finished treatment. So sort of as a comprehensive term. I also want to acknowledge that I know not everybody likes that term or identifies with the term cancer survivor. I hear you. If I'm working one-on-one with someone, I won't use that term if it's not something they identify with. But for the purpose of a presentation, it's sort of the easiest term to use. Okay, so what is cancer-related fatigue? Well, it is a persistent and distressing sense of physical, mental, or emotional fatigue. And so there's various symptoms that it can present with. The most common ones I've listed here. Of course, physical weakness and sense of tiredness are sort of what we often think of when we think of fatigue. But there's also that cognitive piece. Sometimes people refer to this as brain fog. It can also impact mood, motivation. And importantly, this kind of fatigue is not alleviated by rest. So it's not a matter of, oh, I just need a couple good nights sleep. That might be important, but it's not going to alleviate the type of fatigue that is caused by cancer and cancer treatments. We know it's really common, and I'm going to guess that if you're on tonight's webinar, that either you're experiencing fatigue or maybe you're here because a loved one is. So you probably have a pretty good understanding of what that feels like. But in terms of how common it is, most people will experience fatigue during cancer treatment. There's a range of values. I've reported 50 to 70%. There's occasionally studies that even report higher numbers. That's going to depend on the cancer type they're studying and the stage of someone's disease, and also how the researchers sort of define fatigue and what their threshold is. So that's why we're always going to get ranges of frequency, but really common during treatment. It's also quite common after treatment has finished. And again, we see a range of values here. There was quite a large Canadian study done, I think in 2017 or 18, that surveyed Canadian cancer survivors across the country who were 1 to 3 years out from treatment. And they reported that 67% of people reported ongoing fatigue. There are some studies specifically in blood cancer. Those tend to report values a little bit lower, around 25%. But in any case, we do know that it's common both during and after treatment. What are the impacts of it? Well, fatigue, of course, is associated with a lower quality of life, which is sort of your general sense of well-being. But more specifically, individuals with a history of cancer who are experiencing fatigue have higher rates of depression and anxiety. They often have worse sleep, and that's a bit of a vicious cycle. Often difficulties returning to work. So some of you are probably retired before you were diagnosed, but others are probably still working and may have had to take time off. And ongoing fatigue and brain fog are two of the biggest reasons or barriers for being able to re-enter the workforce. And this, of course, can create financial challenges for individuals, may also impact people's identity and sense of self. There also are financial impacts for the broader healthcare system. People who are fatigued do tend to seek more medical care, and that makes sense because you're not feeling well. And certainly fatigue can impact people's social lives and relationships. Maybe you used to hike on Wednesday mornings with a group and you don't feel you have the energy to do that anymore, or some people may find it difficult to sit through a church service or things like that. So certainly there can be impacts on interpersonal relationships. So I'm going to quiz everybody on this slide at the end. I want you to memorize all these causes. No, I won't do that. We're not going to go through all of these today. I put a whole bunch of causes of cancer-related fatigue on here because I really want to highlight just how multifactorial cancer-related fatigue is. It is not just one, there's not just one cause. And any given person is probably going to have several of these sort of underlying contributors to fatigue. The other thing I want to highlight right now is that many of these causes are interconnected. And so what I mean by that is, as an example, insomnia is the first thing listed here. So if you're not sleeping, makes sense, you're probably going to experience more fatigue. But insomnia also increases inflammation. And if you look down the list, you'll see inflammation listed as another cause of fatigue. So this is why I have a web here, because often when I think about cancer-related fatigue and the underlying contributors to it, it does kind of remind me of this spider's web where it's very complex. There's a lot of different parts to it, and they're all sort of interwoven, and you can't really move one piece without it impacting another part. And so this complexity is important because that's important to how we think about managing it and treating it. So we're going to go through about half of these in a little bit more detail, and I've picked ones that I think are really more common or better studied and understood, and that I think are good ones for us to review. Okay, so the first one is insomnia, which is difficulty falling or staying asleep, or poor quality sleep as well, which is a little bit different than total quantity. So this matters because insomnia is more common in survivors of blood cancer. It's about twice as common in blood cancer survivors, and this will directly cause fatigue, but it can also impact some of these other causes, including increasing inflammation that we'll get to, reducing often physical activity levels. We'll talk more about that later. So insomnia is a big one. Second one is mental health. So again, similarly to insomnia, mental health concerns are greater in cancer survivors. Again, about double what we see in the general adult population. And depression in particular can present as fatigue. Fatigue is a symptom of depression, but also fatigue can worsen depression because you can't do the things you want to do. So they're very much interrelated, and it can be very difficult to tease apart when someone is experiencing both, what's sort of the cause and what's the effect. Similarly, anxiety can contribute to fatigue and also contribute to worse sleep. So we need to be managing these if they're present for an individual. Nutrient deficiencies. So this could be deficiencies or low levels of certain vitamins or minerals, perhaps even overall just not enough food intake. And this can happen for various reasons in someone who has cancer, particularly if they're going through treatment or recently went through treatments. Certain treatments like chemotherapy, stem cell transplants certainly may lead to difficulty taking food in. People may experience nausea or vomiting. They might have mouth sores that make it hard to eat. Digestive problems like heartburn or diarrhea that again are impacting ability to eat. And so all of this could contribute to a higher risk of developing a nutrient deficiency. There's also some increased nutritional needs during treatment. Some chemotherapy agents can deplete certain nutrients more. If you're recovering from a surgery or stem cell transplant, as your body's recovering, it also has a greater need for various nutrients, and including protein as well. So we want to be thinking about nutrient deficiencies, and through that, we might think about, well, what is somebody eating? What has the last 6 months looked like for them? Have they gone through periods of maybe being hospitalized and not eating as much, that sort of thing? Loss of fitness is the next one, and this will tie in very well with the next section of the presentation on exercise. But during treatment, we know that people do tend to lose muscle mass and cardiovascular fitness. So that's the strength of your heart and lungs and ability to circulate oxygen through your body. And this contributes to the feeling of fatigue. Okay, those were the easy ones. We're going to talk about some of the more complicated ones, but hopefully it won't be too complicated. So I want to talk a bit about the nervous system, and being really specific, we're talking about the autonomic nervous system here, but I'm going to guess that most of you have probably heard of the fight or flight response, which is a stress response within the body. It's what we often call an acute stress response. So if you've ever had to, slam on your brakes in the car, and your heart rate goes really high, and, your hands might sort of shake a little bit for a couple of minutes after, that is your body going into this stress response that we call the fight or flight response. The opposite to that is the very restful state that we call the rest and digest part of our nervous system. I put the technical terms in brackets below. When we're in this rest and digest state, we digest food better, we heal wounds better, we can sleep better, we feel more relaxed. And both parts of this nervous system are really important. We all need to be able to access and use both parts. But what's been found is that cancer survivors who are experiencing fatigue often have an increased fight or flight response. And there's ways that researchers can measure this. And if any of you have smartwatches, they might give you something called heart rate variability. I don't know that it's entirely accurate when it's on sort of your home watch, but that is one way that researchers can measure this. It's a measure of this response. And so why is it that individuals with cancer who are experiencing fatigue have this increase in the fight or flight response? It can be related to cancer and cancer treatments that can cause physical stress and mental emotional stress, right? So treatments are stressful on the body, or they can be, right? If you have to recover from that. And this may be predisposing people to have a bit of this imbalance or dysfunction in our nervous system. Okay, so that's one thing we want to be thinking about. How do we help to support a rebalancing of the nervous system or the autonomic nervous system? Okay, cortisol. This is another part of the stress response. I'm going to guess again that many of you have heard the word cortisol before. Many of you may think it's bad if you hear it, which is very common. Because it is a stress hormone, we often tend to think that it's a bad thing. But it's a really important hormone that our body produces every day. Even the most relaxed, chill person in the world is going to produce cortisol every day. Otherwise, you feel pretty crummy. And normally what happens is we'll release a bunch of cortisol in the morning. That's normal. And then it will decline through the day, and it will be its lowest before bed. And then you can sleep, rest, have a good night's sleep. But it's also been found that in cancer survivors who are experiencing fatigue, this normal balance of cortisol is often thrown off. And so this is a graph here. I think in the interest of time, I'm actually not going to go through this graph, even though I think it's really interesting. It's basically showing that this is in breast cancer, but in that fatigued breast cancer survivors aren't able to increase cortisol levels when they're put in a stressful experience. The top line where we see this nice increase in that line, that's actually the cortisol levels rising in non-fatigued breast cancer survivors. They all had to public speak. That was the stressful event. So my cortisol right now is probably a little bit elevated, and that's totally normal. We want our body to be able to respond to stress in these ways. And we see that fatigued cancer survivors often aren't releasing cortisol in the way that we'd expect. So it may be sort of too low all day. It may be normal in the morning, but kind of high at night, so you can't sleep. So there can be various patterns of dysfunction, but it's quite a common finding amongst fatigued survivors. Okay, and this is the last thing we're going to talk about, and then we're going to move on to some management strategies. The last piece to talk about here is inflammation. Again, this is a word I'm going to guess that most people here have heard. It's a normal bodily process for our body to produce inflammation, which is really just when the body produces certain chemicals that we call inflammatory chemicals, we'll say. And this inflammatory process helps to protect and heal the body, so it's really important. But if it doesn't go away, it can become chronic. We call this chronic inflammation. And generally, chronic inflammation is not a good thing. So again, it's been found that individuals with cancer who are experiencing fatigue tend to have higher levels of inflammatory markers than individuals who are not experiencing fatigue. That's due to cancer itself that can produce inflammation, cancer treatments, and again, the interconnected nature of a lot of these causes of fatigue. Nervous system imbalance can contribute to inflammation, cortisol changes, insomnia. So again, we see how this is all very linked together. But ultimately, when there's inflammation in the body, it sends signals to the brain that sort of tell us that we're sick, because that's the purpose of inflammation. And this can lead to symptoms of fatigue. Sometimes it's called sickness behavior. That's really the symptoms of cancer-related fatigue: tiredness, reduced activity, low motivation, changes in our thinking. Okay, so that's all we're going to do in terms of talking about the causes. But I think the big takeaways are that there's many different causes and contributors to cancer-related fatigue. Most people will have multiple of them happening, and many of them are interconnected. Okay. Let's talk about a few management strategies. So a little disclaimer, what we're talking about today are really very general things, but even still, particularly if you're on active treatment, it's a good idea to speak with your healthcare team before you make changes. So this is a quote by Sir William Osler, who's a Canadian physician in the late 1800s. And I really like this quote. He's attributed to having said, "It is much more important to know what sort of person has a disease than what sort of disease the person has." I think this is a good thing to always remember. But when we think about cancer-related fatigue, I think it's a time when we really need to lean on this idea, because as we saw from that big long list of causes and contributors to fatigue, we have to understand the person. We have to understand not only their cancer history and their treatment history, but also what's their other medical history? What is stress like in their lives? What are the things that they want to be able to do that they're struggling with being able to do? Because when we understand the person, we can better come up with a treatment plan that's more likely to help them. So we're going to talk about, I think I have 4 things in here, 4 strategies. The first one I'm going to defer for now, because exercise is certainly probably the most impactful thing and the most evidence-based approach to managing cancer-related fatigue. And so Nicole is going to talk about this in a few minutes. But I do, and Nicole might talk about this a little bit as well, I suspect, but I think it's helpful when we think about a strategy to kind of go back to our causes and why is it that this is helping? What is it targeting? And I think the reason why exercise can be so helpful for cancer-related fatigue is that it can target so many of the causes. And this is probably why it can be so helpful for such a wide range of people. So exercise can lower inflammation. It can improve sleep. It can improve mental health, particularly depression. Of course, it improves physical fitness and muscle mass. It helps to rebalance the autonomic nervous system. So in excessive amounts, someone out there is going to know that if you run marathons or do Ironman triathlons, you may actually cause an imbalance in your autonomic nervous system. But for most of us, in the exercise that we're doing, exercise can help to rebalance the nervous system. It can improve heart rate variability. And it can also help with mitochondria, which we didn't talk about today. So we'll kind of brush over that. Okay, so some mind-body strategies. Mind-body therapies or mind-body medicine are strategies that help us to connect our mind and body with the goal of improving health and wellness. It's an umbrella term. There's various different strategies that can sort of fall within this broad category. So I've listed a few here, but they're certainly not an exhaustive list. So meditation and mindfulness, I want to spend a moment on. I've listed a few resources here because, of course, I can't teach you how to engage in meditation or mindfulness in just a few minutes, but there are some really wonderful courses. So if you have a pen handy, MBSR stands for Mindfulness-Based Stress Reduction. It's an 8-week course that has been heavily used, heavily studied for various conditions, but it has been found to improve cancer-related fatigue. Mindfulness-based cancer recovery is the next one. It is an adaptation of the MBSR program to be more specific to cancer survivors. And this was actually developed at the University of Calgary. Linda Carlson is heavily involved in developing and studying this program. There are many cities in Canada have local providers. So if you look up MBSR or you go to the MBCR website, which is mindfulcancerrecovery.com. You can see if there's a local provider in your area. In Atlanta, Canada, where I am, there isn't, but they do have an online course on the MBCR website. So there are also online courses available. There's, of course, lots of apps that are very popular, Headspace, Calm, Insight Timer. There's others. Apps can be a great place to start, although I do think courses can offer something really valuable for people. And of course, there's books as well. Hypnosis has some really interesting research in various areas. In terms of fatigue, it's mostly been studied alongside of a therapy approach called cognitive behavioral therapy, but it may have some benefit on its own as well, particularly from a sort of stress reduction, sleep perspective. You'll have to see if there's a local provider in your area, but there is also an app called Reverie that can teach self-hypnosis. It is a paid app, it's not free. Mindful movement, therapies like, techniques like yoga, Tai Chi, Qigong. In particular, Tai Chi and Qigong have quite a strong base of evidence for benefiting fatigue in cancer survivors. Actually, I think we have enough time because I don't have too many slides left. I think I would love to break up my talking for a minute and we can maybe do a little breathing exercise together. I didn't put breathing techniques on this slide. You just can't put everything, but I do think some simple breathing techniques can be a really great starting point for starting to dip your toes into some mind-body strategies. There's various different breathing techniques out there that can help to reduce stress, bring in the moment, bring cortisol levels down, which is great for later in the day, help to rebalance the nervous system. So I can teach you one right now. It's called the physiologic sigh. And this is just one of many. The way the physiologic sigh works is that you take a sort of deep breath in through your nose, Once you get to your normal stopping point, you pause for a moment. And then you take another sort of sharp, quick breath through your nose. So that looks like this. And then you exhale through your mouth. A long, deep exhale. And doing even just 2 or 3 of these breaths, I think most people will find their shoulders kind of come down. Like I can feel this immediate sense of calm. And there are studies that have found improvements in this nervous system balance and cortisol levels, even very acutely, very short term after doing this. So why don't we take 30 seconds and do 1 or 2 of these breaths together? I'll mute myself so you don't have to listen to me breathing. Right. I'd love to do more and do some more experiential things, but we got to keep moving. Okay, so again, mind-body strategies are probably really helpful because they can impact so many of those causes. So mind-body strategies have been found to lower inflammation, improve that nervous system balance, improve sleep, support mental health, improve cortisol. So some overlap there with exercise, but because they can target so many causes, can be really impactful for people. Optimizing sleep. So this is something maybe you can take a little screenshot of or something. I'm not going to go through it in line by line detail, but this is what we call sleep hygiene. Sleep hygiene refers to strategies that we can use not only before bed, but that's a really big part of it, but even some of the things we do during the day that can help us support better sleep at night. So, waking at a consistent time in the morning, getting exercise, not having caffeine in the afternoon and evening, keeping your screens and bright lights out of your bedtime or before bed routine. So I'll let you kind of look through this, but I think really focusing on sleep can make a really big difference. And many people I work with aren't doing a lot of these strategies. And again, sleep is helpful because it impacts so many parts that we talked about. All right, so I think we are coming to the end here. Oh, I think I've lost my control. Oh, there we go. So I'm not really going to talk about nutrition for the sake of time, and because it turns out you can speak with an RD for 30 minutes for free, and that's really fantastic. I would encourage you to do that. The only thing I'll say is there's a couple studies in cancer, one of which is in lymphoma survivors for fatigue management, that also really focus on including some omega-3 rich foods, so kind of more of a Mediterranean style diet. So this may be something to consider. And again, nutrition can support so many of the underlying causes. And then talk to your healthcare team if nothing else is helping, because there's other strategies and you might need some blood work or some other approaches. Okay, so I will end it there and hand it over to Nicole. Thank you so much.
Thank you so much for your informative presentation on managing cancer-related fatigue. Our next panelist is Nicole Culos-Reed, who is a professor of health and exercise psychology at the Faculty of Kinesiology and a U of Calgary Research Excellence Chair. She is currently the Associate Dean of Research for the Faculty of Kinesiology. And Nicole Culos-Reed's research takes a transdisciplinary approach to understanding and improving the quality of life of individuals living with and beyond cancer, developing, delivering, and evaluating physical activity programs to address the physical and psychological challenges experienced throughout treatment and into survivorship. Please, everyone, let's give a warm welcome to Nicole Culos-Reed. Over to you.
Thank you very much, Isabella. And thank you to Ellen for that excellent setup of the complex nature, really, of cancer-related fatigue. I'm just going to really get my slides going here. Let me see. There we go. Okay, so hopefully everyone can see these slides, and we're going to really jump right into the understanding of the role of physical activity. But before I get started, I just want to acknowledge that the work that I do is situated on the traditional territories of the peoples of the Treaty 7, located in Calgary, southern Alberta. We're privileged to be able to work, play, and do the care and the research that we do in cancer and exercise, acknowledging what we can learn from and how we interact with the Indigenous peoples. So Ellen did a really nice setup of cancer-related fatigue. I just want to highlight a couple quick points, and then we're really going to jump into the evidence and the resources that are available to support you. So as was mentioned, cancer-related fatigue is very common. Nearly everyone will experience some level of fatigue, whether it's during treatments or after. However, for many people, that fatigue can persist for even months or years following completion of cancer treatment. And as was mentioned, this isn't just I'm a little bit tired by the end of the day. This is fatigue that's not alleviated by rest, and fatigue that really negatively impacts an individual's ability to engage in the activities that they want to do. Unfortunately, it's a complex issue. I mean, you saw that whole list that Ellen said she was going to quiz you on. And so it's really hard to pinpoint what is going on. And that can really shift an individual's experience of fatigue. When you don't get an answer, and you don't have something that is just here's a pill, take this and we'll manage your fatigue, it can be frustrating and it can be isolating given the impact it can have on engagement. We know because of the lack of really understanding of fatigue, its mechanisms, its treatments, and then also what can you engage in, it can be frustrating and isolating. And often we know that CRF really isn't addressed clinically in that setting by the clinical team. Oftentimes, and we still have people coming into our programs, they'll report that they were told, well, get ready, you're likely going to experience fatigue. There might be some things you can help to manage it, but you're just going to have to kind of work through it, right? So not as excellent as if there was, hey, here's our best evidence-based treatments, or here's some resources you can tap into. Still doesn't mean the resources are going to be perfect, but it would be nice to have, a clearer pathway for management of cancer-related fatigue. So that really is going to get us into, well, what's the role then for physical activity or exercise? Before I start talking about the evidence and what we know to date, I just want to clarify some terms. Most of what you'll see in the literature looks at exercise. So structured, planned programs for individuals living with and beyond cancer to look at the element of cancer-related fatigue, whether it's the primary outcome in the studies or secondary. But exercise, meaning that they were delivered a structured intervention. Sometimes we hear the word exercise, though, and that can feel intimidating, especially if we don't believe we are an exerciser, right? So if you came into the experience being sedentary or hadn't done any structured exercise for years, hearing that let's start exercise for fatigue doesn't sound that appealing, I would bet. So I would encourage you, even if I'm using the term exercise to describe the research, to think about just being physically active, or even more simply, just think about moving. Most of us can move, and most of us could probably move a little bit more throughout our usual day, right? So think of even what you're doing right now, sitting, and maybe encourage you a couple times during the rest of the presentation to stand up and out of your chair a couple times, or take your arms out to the side or up overhead, right? Just move, roll your shoulders. You can do the deep breathing that Ellen worked you through. Any of these pieces are about ways you can simply think about moving more, right? And that may be more appealing, especially when you are dealing with fatigue, than thinking about exercise. So just keep that in mind. So what do we know? Well, as I already mentioned, it's not something that is commonly well treated. So even though the vast majority of individuals going through cancer treatment or post-treatment will report having cancer-related fatigue, an early study done by the National Comprehensive Cancer Institute found that only 5% of clinicians treat it, right? So again, it's that, oh, I'm sorry, you're going to have fatigue. Good luck in managing it kind of perspective. However, in more recent years, we have many studies published and a number of reviews showing that various forms of physical activity or exercise can be beneficial in kind of disrupting what we like to call this vicious cycle of fatigue, right? So when someone's tired, right, typically that fatigue results in wanting to be more sedentary or feeling like you have no option. You have to become sedentary because you have no energy to move. That sedentary behavior can lead to deconditioning, right? So that sitting and resting without getting the body up and moving deconditions the body with an actual loss of muscle, this muscle atrophy. That in turn contributes to feeling more tired. And so you can see someone starts at a certain activity level and then they start resting because they're tired. They become deconditioned, they lose muscle mass, they become more tired. And you get this downward spiral. The evidence is really showing that we can use movement, we can use exercise to break that cycle and start to have an individual work up to feeling more energized and less fatigue over time. So I was part of a review led by Dr. Lillian Sung out of Sick Kids Hospital in Ontario that looked at randomized trials. So randomized control trials are our highest level of evidence where we look at one group who gets an intervention and then a comparison group, a control group. And so we looked across the literature. This team did a series of reviews. But the one I'm sharing on the screen here is looking at physical activity randomized control trials. And we conducted a meta-analysis. So we took the findings across the different studies and ran statistics on that work. So we were able to include 123 randomized control trials. So that's really our gold standard of comparative evidence. And across the board, we found that physical activity interventions reduced fatigue severity. Interestingly, the effect didn't really differ based upon who the patients were. So these were mixed cancer types. There were some studies just in breast, some with prostate cancer, some with mixed groups, including blood cancers. It also didn't seem to matter in terms of the intervention. So the type of physical activity, the dose. There was a little bit of a duration effect. So the longer the intervention, we tend to see increased impact and improvements in fatigue. So interventions greater than 8 weeks in particular showed more benefits than shorter interventions. But really, because we see this reduction in fatigue across groups, across different physical activity types, gives us a lot of credibility in saying, well, there's something going on here, something beneficial when we see this across the board impact of physical activity or exercise on fatigue. That evidence has really been reinforced in the literature that was summarized for the latest cancer and exercise guidelines, which were published in 2019 through a working group with the American College of Sports Medicine. So as you can see here, cancer-related fatigue, it along with health-related quality of life, those are our two most often studied outcomes in the exercise oncology literature. And you can see for cancer-related fatigue that there are specific guidelines where we really see the evidence showing its benefits. So aerobic types of activities, so that's any walking, swimming, anything where you're working your heart and lungs, 3 times a week for at least 30 minutes at a moderate intensity. So 90 minutes a week of movement. You could be dancing in your kitchen, could be getting out for walks, maybe you're golfing and walking. Any of those types of activities are the aerobic type of benefit. In addition, resistance training. So that means using your own body weight or adding in light weights or those stretchy physio bands at least 2 times a week. And then there's some specifics around the dose, 2 sets of 12 to 15. So doing 12 bicep curls as you're sitting there listening to me right now, 2 times, right? That would be an example of 2 sets for 12 to 15 reps and working the major muscle groups. So that is where the evidence currently lies in terms of positively impacting cancer-related fatigue. So compelling evidence to be included in the exercise guidelines. We had to have a bulk of evidence really showing this consistent benefit of moving more for managing cancer-related fatigue. The cancer and exercise guidelines, therefore, are really what we consider the gold standard of movement. But I'm going to put a big caveat around that because for many of us, depending on where you are in the cancer journey, depending on prior activity levels, past experiences, or maybe even what you have access to, sometimes those guidelines aren't where we're going to be starting off at. And for some of us, they might not be where we ever get to, and that's okay. The guidelines are based on, again, the evidence and where do we optimize health benefits or health outcomes. And so you can see there, just like it is for the guideline for fatigue, 90 minutes of that moderate intensity aerobic activity Brisk walk, like you're late for an appointment. That's a moderate intensity level. Strength training 2 days a week. And then the guidelines also include flexibility. And I would add that more and more we know the importance of balance training as well. Okay, so these are the optimal guidelines. However, if you're getting 10 minutes a day, 3 times a week, that's better than nothing. So a good rule of thumb is some is better than none, and maybe a little bit more sometimes is better than just that some. Okay, but not jumping to, okay, I heard Nicole talk, and if I'm going to get rid of this fatigue, I got to jump right to 90 minutes. The opposite would likely happen. If you overstress your body by taking on too much too soon, you're likely going to decrease your energy and exacerbate fatigue. So the whole key around using guidelines with for exercise to help manage fatigue is really about doing the right amount at the right time for your body. And so that really comes down within the guidelines to this last gray box here. Guidelines are great. Having this knowledge and saying, okay, here's where we're going to optimize outcomes. And I should mention the latest research really showing that these guideline levels are related to survival benefits. But to optimize them for each individual to get the best out of their movement, it's really that we have to think about that individual. Individualize and tailoring are absolutely necessary. So what I might consider or be able to do each and every week that improves my health outcomes could be different from somebody who has just started treatment, or somebody who is 3 months post, or somebody that is pre even starting treatment, right? So that individualizing and tailoring, that's how we optimize the benefits of exercise, whether it's for cancer-related fatigue or any other outcome. And so that's a quick snapshot of the research evidence. What I want to share now then are some of the exercise resources or the interventions that we've built that are evidence-based. And for many of you, no matter where you're listening from tonight across Canada, may be an option to access. I saw already, I answered, I think, one of the chat comments about our ACE program in Alberta. And so I'm going to share just a little bit about ACE and the other resources that are available. So ACE is the Alberta Cancer Exercise Program. This was a study in Alberta. It was led by Dr. Margie McNeely out of the University of Alberta, and then I was the co-lead out of the University of Calgary. And it was really an opportunity to build a provincial program to bring exercise into standard cancer care across major urban sites across Alberta. So if you're listening today and you're not sitting in Alberta, ACE really isn't an option. It's just for those sites. It does continue to run. So the main study, the effectiveness implementation trial around ACE is done and showing benefits on management of fatigue as well as a host of other outcomes. In Southern Alberta, we're continuing to offer ACE, as is Dr. McNeely up in Edmonton. And it's transitioned into a program for us in Southern Alberta. And so we offer a number of programs that are available online or in person across all of Southern Alberta, not just Calgary. But based on ACE, we developed a model to take that 2 times a week program, it's a 12-week program, and deliver it online in our Excel program. So Excel is funded by the Canadian Cancer Society and our Canadian Institute of Health Research, CIHR. And we are delivering this program, again, primarily online, but across the country, targeting individuals who do not have access to exercise oncology programs where they live, and in particular with a focus on those living in rural, remote regions. So if you're listening from somewhere in the Maritimes, Excel would be an option available to you. If you're in Quebec, we have Excel in French. I'm actually sitting in Montreal tonight for a conference this weekend. If you're in Ontario, depending on where you are, and if there again are not resources in a maybe more urban setting, you may also be eligible for Excel. So Excel or ACE in Alberta, these are free exercise trials or programs that may be available to you, and I'll have some information up at the end. But as you come into these, we screen you, and one of the pieces we would screen you on is fatigue levels. And based on your screening, whether it's management of treatment-related side effects like fatigue, comorbidities, or other limitations to engaging in exercise, We then bring you into a group-based program that's going to be able to address your needs, so it'll become tailored for you. You're measured pre and post, and that's for us to collect some data, but it's also for you to see the changes that you make over time, which in and of itself can be a very strong motivator for continued engagement and movement. So here's a few more details. Sorry, some of the slides look like they've moved around a little bit. But again, Excel is for any individual, pre-post or within 3 years of cancer treatment completion. You have to be able to engage in at least a mild level of physical activity or exercise, be adult. Again, we offer this in both English and French. And Excel has set start dates. So right now we are recruiting, and people would be coming and start to be screened at the end of this month in early December, and then they would start up in January. So programs will start up, delivered by different hubs across Canada as of January for the 12-week, with 2 classes a week, and each is an hour. Now, whether you're in Excel, ACE, or another program, one of the key pieces is really using movement that always makes you feel better, right? So whatever you're choosing to do, whether it is coming into one of our programs, doing stuff on your own, or accessing something else in your community. So 2 tools that we use each and every class, pre-post the entire program as well, are to use what we call our fatigue and energy thermometers. And these can be something physically you have and look at and mark down, or they can just be a way of thinking about how is my body feeling as I attempt to move more. So when you start, maybe you're often like me, I start and think about doing exercise and I'm tired. So just getting there can sometimes be half the battle. So sometimes I would rate my fatigue quite high at the beginning of a session. As I get going, I start to feel better and that energy builds. And that is what we want whenever you move, whether it's going out for a walk, doing a group exercise program, doing a video from home, or whatever else it may be, is that you see that shift. Fatigue, being tired, maybe a little bit to start, but not enough, not that overwhelming fatigue where you really can't get started. And then that shift of energy increases as you go and fatigue goes down. When we use tools like this to monitor for each and every time we move, we help to ensure that we're going to potentially optimize the benefits of the movement for managing our fatigue. Now, Ellen's already brought up a few of these other pieces. Some are movement-based, like yoga. We've got a large program in yoga and resources available online for that as well. Tai Chi. But there's other activities, the meditation, the breath work, support groups, or journaling. These are all different pieces that have been studied. Some of them show varying levels of evidence. But I can tell you from the work that we've done and the review that we did, the bulk of the evidence and the strongest evidence is really in the role of movement or exercise. I do want to highlight, although I guess Ellen already did this quite well with the MBCR, the mindfulness-based cancer recovery. But we know that mindfulness, especially on days maybe where you really are tired and your body feels like it can't move, the breath work, which is a form of movement, you're moving your chest, right, as you enhance and take air in through your lungs. That and this mindfulness component can be really beneficial for decreasing the impact of potential stresses in your life, and engaging in some self-care. Taking that time, whether it's 5 minutes, 10 minutes, or half an hour, to release the tension, to pay attention to how your body feels, and to just sit with yourself and engage in some self-compassion. Mindfulness is also an excellent tool as we experience stressors in our life, and to really be able to acknowledge those things, but let them pass through, right? To be focused on the present and to be able to shift your energy and shift your focus, to induce that quiet and peaceful mind. There are a lot of other relaxation techniques, again, some more movement-based, progressive muscle relaxation, so tensing and relaxing throughout the body, scanning your body. I always suggest to individuals when they're starting our programs or on days when they're tired and they don't feel like they can do any movement, is scan your body from the top of the head to the tip of the toes. And that fidgeting we tell young children not to do, do it. move, right? So just even while you're sitting here tonight, you can move your ear side to shoulder, back and forth, or chin down to your chest, rolling through our shoulders, opening up through our chest so that we give our lungs that opportunity to move deeper by having that better posture and that openness through our chest, right? And scanning your body that way, side bend, side to side, while you're in the chair, lying down or standing up, moving all the way down to your toes where you can point and flex and rotate your ankles. Taking that 3 minutes, 5 minutes, or longer doing a yoga session, but scanning that body, releasing tension where you might hold it, and that little bit of movement can be beneficial and potentially energizing and help to manage fatigue. The other couple of strategies, and you may have heard these or received pamphlets on these, but we like to talk about activity pacing and the 3 Ps: planning, prioritizing, and pacing throughout the day. For engaging in physical activity, there's no hard and fast evidence saying, oh, yes, you have to do it just in the morning, or it's better to do in the afternoon. We typically see that people can, and when they can engage in physical activities where they feel they have a bit more energy, right? It can be really hard to motivate yourself to be physically active, whether it's a walk or coming to one of our classes when you're completely drained and exhausted. And so taking that time to kind of see, where do you feel like you have the most energy in your day, and can you start to fit in some movement during those times? Or at times, maybe just as you know you're going to typically fall into maybe feeling more and more tired, maybe a brief exercise snack, 5-10 minutes before you go into that, what typically might be your most exhausted part of the day. See if you can do that for a while. Maybe that changes how much you feel exhausted. Maybe it levels up or moves up a little bit more. So a couple take-home messages and then a few resources. We know that cancer-related fatigue and its association with stress are likely there, and these are both very common across the cancer experiences. Being able to find support, to talk about this, to access resources through your healthcare providers, a support group, or family members and friends, that connection and that ability to share can really help to remove some of the load. Looking at strategies like those 3 Ps, to pace, to prioritize what's important for you, and find that opportunity to engage in some more physical activity. Think of that little bits of activity, exercise snacks, 3 minutes, 5 minutes, whatever it is, just moving your body, even if it's stretching, as a starting point to starting to move more. Activity really is our very best evidence-based strategy to manage cancer-related fatigue, right? There is not a single pill, a single cognitive behavioral therapy, nutrition, or sleep strategy that we know diminishes fatigue as much as engaging in regular movement. Okay, and then finally, practice self-compassion. There may just be some days where um, it's just your body just needs to rest. You maybe need to have that nap. And we always hear this from people, well, I'm really tired every afternoon. I've been told not to nap. If it's a short nap, there's evidence suggesting, as long as it's not going to be so long that it disrupts your sleep, if that's what you need on certain days to get yourself through, to do the other things that are important to you, then take that and don't beat yourself up over it, right? Practice that self-compassion and do what you need to do for your body. If you are going to start to move more, I think Ellen's point about, making sure you consult with your healthcare provider. In our case, we screen everybody who comes into our exercise programs. A clinical exercise physiologist assesses your risk, and then you are placed into a program based on if you're high risk or low risk. As you start to move more in our programs or on your own, our mantra is always start low and progress slow. Right? We lose, as we become more sedentary, as we go through cancer treatments, that physiological change happens over time, and it takes 2 to 3 times as long to build that back up. So we don't go from 0 to 90 minutes. We don't even go from 0 to maybe 60 minutes throughout a week. Take it little bits at a time and build it up slowly over time so that you allow your body to readapt and to rebuild those physiological aspects that have been diminished. accessing exercise oncology programs that are tailored to you can improve the safety and potentially the benefits that you'll see. The programs that we've designed and that others have as well are supervised and led by qualified exercise professionals who are trained in exercise oncology. They're built from solid evidence. So the ACE program that we currently implement in Southern Calgary is based on what we know to be effective from the ACE effectiveness implementation study. And then, we're trying to remove the barriers to access. So we do have those online as well as in-person programs. And oftentimes that online removes barriers of having the energy to get out and go to a program as well. Ultimately, pick what fits for you and what feels good for your body, because when you can pick things that are accessible and that work for your lifestyle, then you're more likely to stick with them. And we don't see the benefits of movement or exercise for cancer-related fatigue unless you do it on a regular basis. Finally, building in some goals to support getting in some movement minutes, those exercise snacks, a little bit every day. And I mean literally a little bit, 3 minutes, 5 minutes, start with that a day and see how your body feels. So we've got a lot of different resources that can help you start to build that movement pathway. We have a wonderful Thriver manual, which has got a lot of wellness-based information and guiding for starting to move more. And we've got exercise infographics, things like setting goals, like building in social support and managing your barriers. These are all free on the website you see at the top, so you can go in there and go to the Thriver section and find these resources. Finally, if you heard anything about Excel in particular, or ACE if you're listening today from Alberta, don't hesitate to reach out to us. You can reach out to Juliana, who's our research coordinator for Excel, or to my lab email, thewellnesslab@ucalgary.ca. We also have a website at the University of Calgary, and we have a YouTube channel on that website with a whole host of videos, showing exercise programs, whether it's our full 12-week program or it's short videos showing you different exercises. And just a reminder that if you're accessing anything that is recorded online, it isn't supervised, right? It's just there for you to use. So just make sure you're cleared for exercise before you engage in even watching any of those videos. So with that, I'm happy to end and then turn it back over to Isabella for questions.
Awesome. Thank you. I think we can all agree that was incredible information. So thank you, Ellen Conte and Nicole Culos-Reed, for sharing your expertise and insight with all of us. And I will now invite the participants to send us their questions, and I will ask them to our wonderful speakers. So I know a few of you have already been sending those in, but just to refresh, there's a Q&A button at the bottom of the screen. And if you click there, you should be able to ask some questions. So just to get us started, one person has asked, since blood cancer patients are immunocompromised, should we avoid public gyms?
Yes. The short answer, I mean, it really depends. You can use personal protective masks, not using any of the drinking fountains in gyms. Most often the recommendation is if you're immunocompromised, especially depending on where you in phases of treatment or with longer term treatments, avoiding germ-filled spaces such as gyms is probably a best bet. Pools in particular, we get often asked about swimming, and oftentimes that is a potentially higher risk activity. Depending on the nature of the gym and cleaning, gyms are, post-COVID, that's maybe one of the very good things with gym. There's stronger cleaning protocols, and so sometimes that can be can make the place safer. And so it really depends on what you're doing at the gym, who you're interacting with. But yeah, if you're worried about your immunosuppression, then I would say avoid going into that public place and access either online or specifically tailored programs for the cancer populations.
Thank you. And before I moved on to the next one, Dr. Ellen Conte, did you want to add anything to that or?
No, I think that's fine.
Okay, perfect. So our next question is, can you discuss exercise for those with significant anemia, and risk for falls with added SOB and dizziness as well?
I'm not sure what SOB is. I see the question. Shortness of breath. Yeah, okay. So, I'm not a physician, and so I won't give any medical advice and specifically related to anemia. Most of the exercise guidelines in the literature do have cutoff points. So that is part of the screening. If we have people coming into our into our programs, our intake form and the screening for readiness for physical activity would both assess those. And so if individuals, and I'm sorry, I don't have the numbers in front of me, but if there are cutoff points, and maybe Ellen has more on this, then those are individuals where we would refer them back to their healthcare provider for either additional testing or screening and clearance before we would bring them into our program. So on any potential participants where we've got questions that our clinical exercise physiologist can't determine safety within their scope of practice, we always refer back to their current physician, whether it's the GP, oncologist, or other, to make sure that we have got dialogue with them to bring them into the program and ensure its safety.
Thank you. We had another question come through around seasons. So are there additional benefits to exercising outdoors in any specific season or anything like that?
There is an excellent body of literature and even more emerging on the benefits of nature, right? And so sometimes simply going outside for that deep breath can bring a sense of calm, rejuvenation to the body. Forest bathing, other practices such as that, nature walks, there's more and more on that. So my answer usually for people is, if you enjoy being outdoors, if that brings you happiness, then absolutely get your walks outside or do activities such as gardening. All of those are types of physical activity and movement. So those can all be very, very beneficial. And again, if you pick something that you enjoy, you're more likely to stick with it. And when we stick with it, we get the benefits. So there's not a lot of research directly comparing if it's better than an indoor-based program, or if there's something different. We don't have that comparative evidence. We mostly, though, just have reports and qualitative research really showing that for some populations and individuals, they find it beneficial, and that for some, there's a little bit of research looking at those who may be immunocompromised, and sometimes being outdoors, if it's not a crowded setting, can be a safe way for them to engage in exercise or movement.
I had to sadly remove my slide on time and nature because I knew we weren't going to have enough time, but maybe that is one I should have left in. I will just mirror what Nicole said, that there is a really wonderful and growing body of literature on benefits of time and nature. There's a little bit of data specific to cancer fatigue, but there's a lot of data on sleep and pain and focus and cognitive function and mental health. So I think spending time in nature can be great. And if it's hard, and that can be urban parks, there's even data that even having nature views out your window and some of these more sort of passive nature experiences can have benefit. So including that, whether it's through exercise or other aspects of other areas of your life, I think is a great addition.
Wonderful, thank you. We have another question. Acupuncture is used to treat inflammation or pain or fatigue sometimes, but can someone with CLL, blood cancer, do acupuncture treatment?
I actually don't have a correct answer to that question. I would speak with your healthcare provider. There are, if white blood cell counts are extremely low, I think there is a place where there should be some caution because you are inserting a needle through someone's skin. And sometimes individuals with blood cancers may have neutrophils that are extremely low. I've seen 0, 0.5, and you start getting into those kind of numbers. I think some caution is warranted. I don't know offhand if there's a specific number. I don't know if you know, Nicole, if there's any specific guideline on it, but I would speak with your oncologist if you're on treatment. I don't think there's really much risk of, well, there could be, if your platelets are incredibly low occasionally, like it's pretty rare that acupuncture causes blood, but occasionally it can. Again, sometimes people going through treatment for blood cancers can have extremely low platelet levels. So I do think that, I don't know where the exact number would be drawn, but that caution could be warranted at a certain case. So I would speak with your oncologist about it, but I'm sorry, I can't give you a specific number.
And I'm seeing nodding, so I think we're both on the same page for that one. Perfect. Okay. And I think with the interest of time, that looks like that will have to be our last question for this evening. So I want to say a big, big thank you again to you, Ellen Conte, and to you, Nicole Culos-Reed, for sharing your expertise and information. I want to say a big thank you. This was wonderful. And then we're just going to move on to a couple of slides for wrap up now. Wonderful. Alrighty. So, we want to learn how your blood cancer has shaped your everyday life. Please take the survey to share your experiences to shape how support changes. You can scan the QR code on the screen or copy the link there as well. Thank you. All right, next slide. We would also like to thank Johnson & Johnson, Jazz Pharmaceuticals, GSK, Amgen, and Kiona Kieran for their support in making this event possible. We couldn't do it without our sponsors, so thank you so much. And then finally, just to leave you with, please remember that we are here to help you. Contact us, and please note that a short survey will be sent to all participants after this presentation. We thank you for taking a moment to respond as it helps us plan future events. So thank you all for being with us today. Take good care of yourself and have a great rest of your afternoon.